Hi guys, welcome to my Ohi Comp video. Today we will be discussing periodontal disease. We will talk about gingivitis, patients with caries, different types of toothbrush brushing, flossing, all the different types of that. And we will be talking about aftercare instructions following procedures. Alrighty, so first we're going to jump right in to periodontal disease. So what is periodontal disease, you might ask, first of all? Well, it is advanced form gum disease where the gum tissue pulls away from the teeth, which creates a pocket between the tooth and the gum, which can have bacteria get in there, which can cause an infection, which is a whole big deal, and it is not good. So it starts off with swollen gums, but in the end, if we don't treat it, you can end up losing your teeth. Periodontitis can destroy tissues, ligaments, and bones in the mouth. And like I said, that ends up you losing your teeth, and no one wants that. So the prevention, you can prevent it by keeping healthy oral care habits, such as brushing your teeth twice, 3 times a day, flossing at least once a day, and also using a mouthwash. Prevention is much easier than treatment. But prevention past a certain point is much harder because you have to have a professional perform your treatments and your upkeep. This could be oral surgery, depending on the severity, because some other options would be tooth scaling, root planning, flap surgery, grafts, doxycycline gel, chlorhydrin chip, mycosylene microspheres, and doxycycline pills. Big words, we don't want to deal with all that, right? So some of your signs and symptoms of periodontal disease is sore gums, receding gums, pain when chewing, poor tooth alignment, meaning your teeth are starting to get crooked, turning, and not being straight in your mouth like you want. Another sign is receding gums, pockets between the teeth and the gums, constant bad breath, sores all over in the mouth, and loose teeth. What can cause periodontal disease? So, like earlier stated, you need good hygiene to keep it. So, bad oral hygiene can bring on periodontal disease. Smoking and tobacco use is a major one. Not removing all the plaque on your teeth, which relates back to bad oral hygiene, stress, hormonal changes, poor nutrition, medications, and chronic disease can all bring on periodontal diseases. So the toothbrushing technique for periodontal disease is called a modified Bass. So you will be at a 45-degree angle and making circles along each quadrant, which is 1, 2, 3, and 4, which divides in between your front 2 teeth and your bottom 2 teeth. And so you will make circles along each quadrant for 15 to 20 seconds on both sides, so the front and the back of your teeth. So how do you floss with periodontal disease? You will want about an arm length string of floss. You will want to start the end, wrap it around your ring finger. Wrap the other end around your ring finger. And then you want to go in between your teeth and do a C motion. Get real close to the gums and bring it up around your tooth. And then when you're done with that side, you unravel and re-ravel to a different spot. That way you're not carrying the plaque that you just removed from one spot to the next spot, because that would be very bad. That would help periodontal disease form. We don't want that. Another great tool is the water pick. This is my travelable size one. So basically you fill it up with water. This one has different modes on it. Each water pick is different, but I recommend flossing and water picking. That definitely helps you get both. If you have braces like me, water picking definitely helps me the best, but flossing also brings great results. But if you can't floss and you have motor issues or anything like that, and you can't or don't have, there's mental health issues and all that, and if you can't bring yourself to floss, this is at least something. It does not replace flossing, or it might. There's a big debate, but I recommend using both. And here is a photo of periodontal disease. So it starts off with just simple, nothing much, just regular. It just has healthy tooth and gum. Second step is gingivitis, which we will talk about momentarily. The third step, you can see, is pulling away a bit. It's very red. That is part of the periodontitis. And then we have advanced periodontitis, which is like severe. We don't want that. All right, now on to gingivitis. What is gingivitis? It is a form of gum disease that happens when plaque builds up on the teeth. It causes inflammation of the surrounding gum, but with proper dental care, it can be prevented and reversed. What causes gingivitis? This one is also smoking / tobacco use, poor oral hygiene, not removing all the plaque, stress, hormonal changes, poor nutrition, medications, and chronic disease. As you saw in the periodontal disease figure that I showed you, gingivitis is step number 2 on it. So what is treatment and prevention for gingivitis, you might ask? Well, use anti-gingivitis toothpaste and mouthwash. Crest has some. You want to brush twice a day for at least 2 minutes. Floss at least once a day. Replace your toothbrush at least every 3 months. If you have electronical, replace the head. That way you have a new brush every 3 months. If you have manual, toss that one out. Get a new one. So replace it every 3 months. And if you are sore or bleeding after your care, after you're done brushing or flossing, do not stop. Keep taking care of your teeth. But do cut back on high sugar foods. Some signs and symptoms of gingivitis is red puffy gums, bleeding gums, sore gums, some tooth pain or sensitivity, bad breath, and that's your signs and symptoms. But for your brushing techniques, you use the modified Stillman technique. It is a short movement at 45-degree angle hitting the gum line and down your teeth and swipe out any bacteria from the gum. Of course, you have your floss, and like I said, ring finger, ravel, in, C motions, unravel, ravel, unravel. Of course, with flossing, you can always use your water pick. All right. Next, we are talking about patient with caries. What is caries? It is another term for cavities or tooth decays. Some signs and symptoms of cavities or caries is weakened enamel, increased sensitivity, small holes on the surface of the teeth, pits in affected teeth, and constant toothaches. But what causes caries? When we eat, bacteria is left on the teeth, which then breaks down the leftover tooth or leftover food that is left on your tooth. And this leftover food from the bacteria produces acids. These acids then go and break down the enamel, which is the outside of your teeth, which weakens the actual tooth, which helps form gum disease. Sounds crazy, but it's more straightforward than I put it. Some treatment and preventions of it is a great prevention is just brushing, using your mouthwash, flushing, and fluoride treatments from your dentists. Make sure you keep going every so often, as long as they tell you, whatever your plan is between you and your hygienist and your dentist. Some treatments include fillings, crowns, root canals, and even extractions. Alright, here is a photo of the stages. So first you have the first one where it is just right on the enamel, not into anything else in the tooth. So pretty easy to fix. You have your second stage, which has it going into the dentin a bit. Third stage, it's going into the pulp. And then you have your very last stage where it is forming an abscess and it is just getting to the point where your tooth might not be recoverable. Obviously, we want to catch it at the first stage. That way it's easier to treat and to fix. But sometimes we don't catch it that fast. The brushing technique for this is modified bass once again. Now, how should a child brush? We've been talking about all the brushing techniques. How should a child brush? Well, they directly on the teeth while your teeth are closed in a circular motion for at least 2 minutes. So, there are flossing aids where you can wrap the floss around it, and that way you can just slide it right through your teeth and then the floss goes around. Obviously, flossing is the best technique. There are these flossing aids ones for people who, or kids who struggle with dealing with a long string of floss and being able to ravel and unravel. We have these, and they are called Pixters. Obviously, if your kid can use a water pick, there's also the water picks. And one extra final brushing technique is called chartering. It is also a 45-degree angle at the gum line, facing the tooth in a circular motion down each tooth. So you start up here, circle motion, all the way down. And you hit each quadrant for at least 15 to 20 seconds on each side. And interdental aids, which is the regular floss or the Pixters. There are also these types of Pixters, which help me with braces to get in between my wire and my tooth to get out any food that is stuck in there. Now, what about people with braces? We've talked about gingivitis. How do people with braces like me take care of our teeth? Obviously, like I said, I have food that gets stuck in between my wire and such. Brushing is a big help. The Pixters that I just showed you helps get all that food out. But we also need to make sure we are brushing using our mouthwash. Obviously, sometimes flossing is hard, but with the help of the dental aids and the water pick, I love my water pick. It helps me so much. But just taking care of your teeth, having good dental hygiene is the best you can do. Especially if you drink soda like I do. You want to brush your teeth right after so our teeth don't stain, because where the bracket is attached, you can have the coloring of the tooth when you put the bracket on versus the outside of all the soda and everything else that you have been ingesting or using or whatnot, staining the tooth. Alrighty, on to providing post-operative care instructions. Alright, the first one I will be talking about is the amalgam. So what I would tell a patient once we have had amalgam filling and I'm sitting them up and I'm talking to them before they leave is do not chew on the new amalgam for at least 2 to 3 hours. Do not eat anything very hard or crunchy for at least 24 hours. And if you do decide to eat, try to eat on the other side of where you got your amalgam placement. With anesthetics being used, your lips and your teeth and your tongue may feel numb for several hours after the appointment. That is totally normal. Just avoid eating until numbness has completely worn off because it is easy to bite or burn. Your tongue or lip will numb. Also, you can end up sucking on your lip and the next day it will be all poofy and big and it will look like you just got punched on in your lip. So make sure you do not suck on your lip as well. You may take over-the-counter pain relievers for tenderness or discomfort. You may take aspirin or ibuprofen unless you are allergic to these medications, which should be in their medical chart, so you should know this, or have a medical condition that would prevent you from taking such medications. These medications will help you from any soreness at the injection sites where your anesthetic was administered. And it is normal to experience some hot and cold and pressure sensitivity after your appointment. The hot and cold sensitivity may linger for several weeks after the placement or filling, but these usually subside after a while. The finish restoration may be contoured slightly different and have a slightly different texture than your original tooth. Your tongue may magnify all the small differences, but you will become accustomed to it in a few days. But if you have any issues or the hot and cold sensitivity doesn't go away within a time, definitely call our office. You let us know right away, and we will help you as much as we possibly can, and we will see you soon. All right, when having an anesthetic. When you have an anesthetic has been used, your lips, your teeth, and your tongue may feel numb for several hours after your appointment. Avoid chewing until the numbness has completely worn off. It is easy to bite or burn your lip or your tongue or anything in your mouth. Please do not suck on your lip or your cheek. I know it might be hard and tempting, but it will make it swell and look bad. All right, composite. When anesthetic has been used, your lips, teeth, tongue may be numb for several hours after the appointment. Avoid chewing until numbness has completely worn off, and it is easy to bite or burn your tongue or lip will numb, so really try not to eat or drink. You may take over-the-counter pain relievers for tenderness or discomfort, such as aspirin, Tylenol, or anything else, unless you are allergic to these medications. These medications will help with any soreness at the injection sites where your anesthetic was administered. It is normal to experience some hot and cold pressure sensitivity after your appointment. If the hot or cold sensitivity may linger for several weeks after the appointment or filling, usually these symptoms subside over time. If they do not and they continue very rough and it is too much for you, contact our office. Your new filling are fully hardened before you even leave the office. However, it is wise to chew on the opposite side of the location that your newly placed fillings until your anesthetic has worn off. One of the most common problems following filling placements with anesthesia is an incorrect bite. If your bite feels uneven, please call our office so we can get you scheduled to correct your bite. If you have any further questions, please ask. Any other questions? But if you have any other questions or concerns once you leave here, please call our office and we will help you as soon as possible for you. All right, crown and bridge. Following the first appointment for a crown and bridge procedure, a temporary crown is placed on the tooth or teeth involved. This will protect them while the custom restoration is being made. Temporary cement is used so the crown can be easily removed off at your next appointment. If your temporary crown comes off between your appointments, just clean the inside, slip the temporary crown back on, and call us right away for an appointment to reseal that temporary crown on. A little Vaseline or toothpaste placed inside the temporary crown will help hold it in place until it is back cemented into your mouth. But definitely avoid chewing on gum, sticky foods, or any type of hard candy that could try to jostle or pull the temporary crown out. It is made out of plastic, and it is not a permanent crown, and so these will come off. But your permanent crown is custom shaped to match your teeth, so it should look exactly like your tooth. It should just say exactly over your tooth. The temporary crown is made to serve for a short period of time, so its color and shape are not as closely matched to your natural color of your tooth. So your permanent will match better, but this is just a temporary one. But be careful until the anesthetics wears off. Due to the strange feeling of anesthetics, people, excuse me, many people will chew on the inside of their lips, cheeks, or tongues, which can cause serious damage. The numbing of the upper jaw will last approximately about 1 hour, and the numbing on the lower jaw will last up to 4 hours. Sensitivity, especially to cold, is common following the dental restoration. The sensitivity may last for several days to several months. Sensitivity, it depends on how deep the cavity penetration to your tooth was. The sensitivity is most noticeable during the first 12 to 24 hours after the anesthetic wears off. It should disappear slowly afterwards. The gum tissue may become irritated during the procedure and may be sore for a few days. And the site where the anesthetic injection was given may also be sore for a few days. Please follow the prescribed oral hygiene instructions. At a 45-degree angle, please twice. 45-degree angle, brush twice a day and floss once a day to avoid getting cavities, gum disease around the filling. When flossing around your temporary crown, slide the floss out. Don't pop up, otherwise you might pop your temporary crown off. The finished restoration may contour slightly different and have a different texture than your original tooth. Your tongue magnifies all the small differences, but you will be accustomed to it in a few days. All right, cementation appointments are a bit different. So here is the cementation. Please do not eat or drink for 30 minutes after your new crown is cemented on. Do not eat hard candy or sticky candy for at least 24 hours while the cement completely sets against your tooth. Your crown might feel tight or as it's pushing against your teeth or the teeth next to it for several hours. This discomfort will go away within a day or two while your mouth adjusts to having this new item in your mouth. Sensitivity, especially to cold, is very common after a crown is cemented. Usually, it's with the deeper cavities. They're more sensitive, but it can take several days or months for the sensitivity to go away. The finished restoration may be contoured slightly different and have a different texture than your original tooth. Your tongue usually magnifies these differences, but you will become accustomed to it in a few days. But please follow the prescribed oral hygiene instructions of a 45-degree angle brushing twice a day, flossing at least once to avoid getting any cavities or gum disease around your new crown. Flossing is especially important in preventing the health of your crown or your bridge. And remember, try to slide out instead of up at least for a bit. That way you don't pop it out. And then we have oral surgery. Avoid any chewing until numbness has completely worn off. Be sure to keep the gauze in your mouth with firm pressure for 15 to 30 minutes. If the bleeding continues, or if it starts again, place a fresh piece of gauze over the bleeding area and bite on the gauze with a firm, steady pressure for at least 1 hour. Do not chew on the gauze. It is normal for the saliva to be slightly streaked with blood for about 1 to 2 days after. And if abnormal bleeding occurs, place a piece of moist gauze over the extraction site and bite down to 30 to 45 minutes. Swelling can be normal and should not cause alarm unless it's severe. But apply a cold towel or an ice bag for 15 minutes or as needed. And as for the first 24 hours, do not rinse your mouth or use any mouthwash products. A liquid or a soft diet is advisable during the first 24 hours. And after 24 hours, rinse your mouth out with warm salt water, which is about 1 teaspoon of salt and about 8-ounce glass of warm water. And repeat this several times a day to help keep the extraction site clean. A liquid or a soft diet is advisable during the first 24 hours. That way nothing gets in the socket. Do not drink any alcohol beverages or smoke for at least 24-hour period. Do not drink from a straw for 24 hours because all this can pull the clot out of your gum and then you will start bleeding very severely again, and we want that clot to stay. Following extractions, it is normal to experience some discomfort. You can take over-the-counter pain relievers such as Advil or Tylenol or ibuprofen, but aspirin should be avoided. Please feel free to call the office to report any conditions that may appear to be unusual, or if you have any questions, concerns, or anything, just reach out. And that is my Ohi Comp over toothbrushing techniques and the aids, and also all the different how to educate a patient, and as well as the post-op instructions. Thank you.